Alright guys, so this is going to be a pretty long video, and the reason for that is I'm going to just tell you about what I expect to happen in my upcoming elective. My elective starts next week, which is the 7th. The 7th of January. And I'm also going to tell you what I've been doing to try to calculate which examination I could do or afford to do at this present point in time. So next week starts my elective at the Kingston Public Hospital in oral and maxillofacial surgery. I'm looking forward to it actually, because up until now, what oral and maxillofacial surgeries I've been exposed to have been either from YouTube or when I was a medical student in Trinidad trying to decide what specialty to do. At that point in time, I felt like I wouldn't be able to do it, so I just ended up going to do 9 months of orthopedic surgery at that point in time. So since then, I've gotten the courage and I've gone on now to, as you know, I'm in dental school. I've been playing for maybe a better part of 6, 7, 8 months in my mind to decide, well, trying to decide whether or not to do the DONS, which is Diploma in Head and Neck Surgery, the Usmle, the Nbde examination, and I've also been thinking about how I would go about funding my ORE examination. So ORE is probably the most expensive dental examination out there right now, and I even looked into doing the Australian Medical Board examinations, but for now, kind of holding off on that idea because, yeah, Australia's kind of far. So just to give you an idea of what's been going on, I'll go into the cost of exams first, and then afterwards I'll talk about what I want to do in my elective period. So we're going to start with the Usmle exam. So as you know, it's in the United States, and you need to have a visa. So the cost of the visa alone is $200 US. So then after that, you have to look at the ticket. Depending on where you're coming from, the cost of the ticket is $500 US. And then the ECFMG certification, which was $50 when I first paid it, is now $75. So you have to pay $75 to register with ECFMG, have your documents certified, etc., etc. So then you have to you register for either step 1, step 2, case 2 CS, or step 3, whichever one you choose. If I was to do the Usmle right now, I'd do step 2 CK first, and that would just be my decision. 2 CK is $910. Step 1 is $910 as well too. The 2 CS examination is actually $1,565. So it's a pretty expensive exam, and I think the step 3 exam is like $2,000 or a little bit more. So they're not cheap exams, but I mean, what's money when it comes to doing something that could benefit you in the long run? You can go and get a first world experience, as well as first world training that you could take back to your country to build your country. Even if you don't leave, even if you don't want to stay in your country, you could go back to your country and perform free surgeries, free workshops, train your country's surgeons, you name it. There are loads of possibilities. Some persons might choose to go into the military. I myself was looking to go into the military at one point in time. I've messaged a few of the militaries around in the first world countries, and as with most places, you have to be living in the country, have a green card, or be a resident, permanent resident, those kind of things. So that I bust luck with those things. So preparing for the Usmle examination is pretty expensive as well too. I've actually booked a question bank in 2013 when I first graduated from medical school, and the cost back then was $250 for 6 months. Now it's gone up to $365 for the U World question bank. But the U World question bank is actually one of the best question banks according to everyone. But here's my thing, and I know I'm going to get a lot of flack for this possibly, but I don't know if I understand what I'm supposed to get from the U World question bank. I'll tell you why. So when I was doing the question bank, I noticed that like my scores were always low. I'd always miss what the question was getting towards, and I don't think I'm a bad physician. So I watched a video recently. This guy who scored 250 in his Usmle question bank. Well, in the Usmle final exam for step 1 and step 2, he scored above 250. And he was saying, don't watch the score. But my question is, if you don't watch the score, for instance, if you did a question bank and you got like 40% of it correct, and you come back and you get 40% of the questions correct again, then something's going on with your prep. So he was saying that the real assessment of your knowledge comes from using the self-assessment sheets, which in itself is that's another like $50, $25 to $50 to $75 for this question bank. So here's the thing. When I do start to do the question bank over again, if I do take the step 1 or step 2 CK, I'll tell you if I pick up any tips or ideas of how to handle the question bank. All I know is that studying for USMLE step 1 is and step 2 CK is very different from studying for the MRCS examination. I actually think that the question banks for MRCS and basically how they ask questions for MRCS are very straightforward. Things that you would see on the ward, things that you should understand, things that you should know. For the OSCE, same thing. Like, it was very straightforward. While the USMLE question has a lot of information in it, and sometimes that information that's offered is not even necessarily what will give you the answer. It will just eliminate other answers. So studying for the 2 exams is very different. So I also found another quick question bank that I actually signed up for, which was called Amboss. Amboss is actually cheaper than UWorld, but if you go to any person's website, they'll always say UWorld is it, and they'll say UWorld is needed. Even if you use other resources, use UWorld. What I've noticed on Facebook, what they do is actually they have like bootleg stuff going around. I'm not going to elaborate much on that there, but that's all you can afford at that point in time. That's all you can afford. So the Amboss has a 1-month subscription that costs $48, and 3 months, which is $123, 6 months, which is $235. Remember, I just told you UWorld is $365, and for 12 months in Amboss, you get the question bank for $365, which is the same cost as a 6-month subscription to UWorld. Now, remember what I said. UWorld is considered essential for the USMLE examination, so I guess they know that, and that's why they charge that. So the UWorld 180 days is $379, so that's pretty decent. And the UWorld 180 day subscription comes with 2 self-assessments. There's a question bank that goes for $329, which is a 90-day question bank. Comes with 2 self-assessments for UWorld. The self-assessments time 1. If you only have 1 self-assessment plus the question bank, you get that for 60 days for $279. So yeah, that's pretty interesting. And if you want 30 days, you get that for $229 for the 1 self-assessment and the question bank. All right. So the Kaplan Q Bank is another Q Bank that advertises like crazy on my Facebook, and pretty much I made a subscription to Kaplan when I was in my 3rd year. Yeah, my 3rd year, and pretty much they flood your inbox with lots of advertisements, 15% off, and they have a discount going on now too. So the question bank for Kaplan, so you have a 12-month Kaplan Q Bank for $170. You have a 18 months for $255, and you have a 24 months for $297, and you can do for 1 month for $85 US. And these quotes are discounted because apparently they're having a big sale. Next exam that I was looking at was the Nbde. So just to give you a little background on the Nbde examination, it's a 400 question exam. It's multiple choice, 7 hours for these questions. It's pass or fail, and the minimum competence is 75%. So for me, that lives outside of the United States, and I do not go to a recognized North American or recognized Canadian, well, basically Canadian or United States university, and basically any of their colonies, I have to pay the extra fee to register to do this exam. So normally you pay $435 US for the exam. I pay $635, so $200 extra. Same thing goes for step 2 of the Nbde exam, $480 for the exam, and then $200 extra. And it's both exams are pass or fail. But step 2 exam for the Nbde examination, it has 400 questions on day 1 in 7 hours, and 100 questions which are like case based, which you're doing 3.5 hours on day 2. So Kaplan because UWorld strictly deals with, I didn't see any Nbde questions on UWorld, but I could be wrong. Kaplan has a question bank. The question bank for the Nbde is $170 for step 1 and $85 for 1 month if you're doing step 2. And then if you want, but both this part 1 and part 2 have question bank access that allows you to access the question bank until your exam for $170, but they're having a discount. So yeah, I was considering doing these examinations, but once again you have to include the fees like visa, flights, because flights to the United States from where I live is like $500 US. But if you know, this is a drastic price difference with the Usmle versus the Nbde, and the reason for that is very simple. And it seems that the exams are cheaper, but believe it or not, the dental part is actually more expensive, because when you do the Nbde, unless you plan to work on a limited license, you actually still have to go back to school for the 2 years. So even though Usmle costs more, in the long run, the Nbde and the dental pathway, you pay more. So there's something to just keep in mind. The exams are cheaper for the dental exam, but you know, you still pay more in the end. And then the last, but by second last exam is the ORE examination. Not really going to go too far into the details about the ORE exam. Just know that the cost is £800 for part 1 and $2,929 for the mannequin part, which is part 2. Past test has a question bank and it's very cheap. It's £40 for 6 months. So prep for the Nbde is pretty cheap. I mean the ORE, what am I saying? The ORE exam is pretty cheap. And then you have to include cost of flying, which is about $1,000 US, which isn't that bad. So all in all, ORE, I'm not ready to say, I haven't met very many persons who have done the ORE exam. I've met like 2 people who have done the Nbde exam. So I think the ORE is actually pretty hard to pass, but it's possible. Just like MRCS is pretty hard to pass, but it's possible. And you just have to keep that in mind, keep focused, and try just to make sure you zone in on what are the high yield questions. Next and final examination I'm going to talk about is the diploma in head and neck surgery. So this is another one that's really high on my list in terms of where I may actually consider doing it. Because if I do consider doing this examination, I may fly up to the UK and do it. Part 1 is £539, part 2 is £977, and the question banks are really cheap. So like question bank for one of them was like £20. If you want the question bank website, you can just message me in the bottom part of the video and I'll tell you. But yeah, it was like £20-30 for 6 months access, 3 months to 6 months access, which isn't bad at all. Then you include the flight, include whatever, most of these things you have to include staying wherever you're going to stay, in whatever hotel. So all in all, it's not really an extremely expensive examination, and I know quite a few people who have gone up past the exam. I'm not certain if you do the DONS, if you get GMC registration with the DONS. I do know if you do the part A MRCS and then the part 2 of the DONS, you can get the MRCS ENT. So that allows you to register with the GMC and get the MRCS ENT. ENT is registrable for a registrable qualification accepted by the General Medical Council of the United Kingdom. So next week is my elective. I pretty much want to scrub in on everything, every single surgery I can scrub in on. So far, my medical practice in terms of my continued training, because pretty much your life as a physician, you're just training for your entire life. I've learned quite a bit, and I must say, while being in an accident emergency, I mean, there have been some instances where diagnoses seem so, far out there. But because of certain policies in the hospitals, and once you follow that there, the diagnosis that you come to, you are actually surprised that was a diagnosis, and you actually understand why the hospital has such a low threshold to run certain tests. I will try to be as specific, but yeah, as non-specific as possible in my example coming up now, which is that like a lady came in with chest pain, and I was saying to myself, just shrugged my shoulder. I was like, you know what? I mean, it's chest pain, and the complaint at that point in time was so so non-specific. But then when she mentioned, that it was crushing in nature, and it comes and goes, and it's at rest. Sometimes she has some sweating and things like that. I was just like, you know what? She didn't even come for that complaint. She came for something totally different. But I said, okay, I focused in on the complaint, got that out of the way, and then I focused in on the chest pain. I said, lady, you're gonna be with us for some time because I need to make sure that something isn't, going on with your heart. She has some comorbidities, but at the same time, we ran the test. Turns out the lady had a heart attack. She didn't even know. She was walking around with this pain and was thinking, maybe it was like acid reflux, the usual diagnosis, acid reflux, MI, dysphagia, odonophagia, you can have, a whole bunch of diagnoses that probably wouldn't point towards one of the more serious ones would be the MI. But yeah, it was an MI. And there have been quite a few patients that have come in and have had pulmonary embolisms, been young, don't fit the criteria for, like, for instance, the Wells score, and they have had pulmonary embolism. So you have to keep that in mind when you're doing your diagnosis. These things can not present, or sometimes can present, like, atypically. So yeah, so next week I'm gonna try to keep a logbook. I'm gonna start a little series with regards to, like, my daily interaction with those in the oral maxillofacial surgical specialty. I can't film much, but what I'll do is just log pretty much everything that happens and show you what surgeries I went through, read up on the surgeries, and come and tell you what we were trying to do, what trauma we come into contact with, and hopefully you like that series. So guys, just please subscribe, and thanks for the encouragement that I've been getting, especially in my comments, and keep posted. Future oral and maxillofacial surgery.